So, hi, it's Dr. Bill Clearfield. This is our patient Melanie, and today we are going to do some lift with PDO threads on her nose, and then we're going to do some pretty simple Botox. We're going to do glabella, forehead, we're going to do the eyebrow lift, and we're going to do the lip flip. And so we already have her sort of numbed up, although we're going to do just a little bit of lidocaine with epinephrine right at the tip of the nose. And this is the worst of it. This is the ouch part. And she's going to, since it's lidocaine with epinephrine, she's going to get a little bit of a blanching of the skin. Make sure we tell the patients that. So it will be gone by the morning at the latest. But they sometimes get a little bit upset because the skin's a little bit different color than when they came in. It's a little bit whiter, but it will go away. So those of you who've seen us before know that we don't do the standard injections, which is, plop it in. So I've been an acupuncturist since 1990 and 91, and when we combine acupuncture technique and using acupuncture points, we get much better take, much less use of product, minimal to no bleeding, and since I've been doing this technique, I've never had an issue with an eye droop. So, all the things that we worry about. So we're going to start right in the center here, the procerus muscle, right there. We're going to use 4 units there. Okay. We use as our landmark the edge of the eyebrow. So it changes for a more mature person, as especially in a female, as they get a little bit older, as estrogen sort of shows the spot where it will retreat as estrogen drops the eyebrow. So a little bit of an ouch there. And now we're going to come around. By the way, our photographer is Melanie's mom. So we'll have to be nice to her too. Okay? And on the other side. So it's 5 injections of 4 units each. And we're going to get you have to inject the corrugator muscles also, or we can put a lot of Botox in there, but it's going to look silly. So we only use 20 units, and we'll get a very nice result. Then we're going to do the forehead. So look up for me, wrinkle up. So where you don't want to go is in the center here. There's one exception, one shot, and we'll talk about that in a second. We're safe as long about 1/3 of the way down. So this crease here we can actually get pretty close to. A lot of times what will happen is this will bleed up, this will bleed down, and we'll get a nice look with just a little bit of expression left. You don't want to block it all out. It looks silly, and it doesn't look natural. And as you know, Botox takes anywhere from 36 hours to up to 10 days to take effect. So we're not going to see a whole lot of difference right away. We use the same landmarks, midline and mid-pupil and the inner eyebrow. 5 injections of 2. So, and again, on a more mature patient, we might do the crow's eyes here. So can you squint for me? And we have just a little bit, so we'll do one here. Turn your head this way just a little bit and squint again. Okay, so we're going to get those there. So there's one there. There's one there. And one there. It's about 1 centimeter outside of the orbital rim. And as you can see, we're getting a very nice take with little to no bleeding. This doesn't take very long. Okay. 1, 2, 3. Now, our last forehead here is we're going to do the eyebrow lift. So we're going to do the edge of the eyebrows. It's going to be 2 units each. 1, 2, and this is the one exception in dead center. I call it the Mo Green point. If you remember from The Godfather, Mo Green was one of the bosses, and one of Corleone's broke into his office, and he said, "Don't you know who I am?" He says, "I'm Mo Green," and he shoots him right in the forehead. So I call that the Mo Green point. Okay, now we're going to, next we're going to do the lip flip. And while you're watching the lip flip, you can notice that the nose is now blanched. Okay? Okay, so we're going to use 7 injections, 1 unit each. The upper lip is treated differently than the lower lip. What we're going to do is we're going to split the upper lip in half, so from here to here, and then half again, and half again. Give us a smooch. Now, she's pretty good as far as no wrinkles above the lip, so relax. Somebody who's a little bit more mature, we might go into one of the wrinkles. So we're going to go right about here, and we go right at the vermilion border, and she's doing pretty well. Just 1 unit, 0.025 cc's, the way we dilute it. Again, 1 unit. Now we're going to go to the other side and do the same thing. So we're going to split the lip again, and then split it again. So right about there, and right about there. Okay, that's the upper lip. That's all we're going to do. Now we're going to do the lower lip, and what we're going to do is we're going to split it in half, but we're only going to do 1 injection in each half and 1 in the midline. That's because we have what were called pillows here, and you want more of a projection in the lower lip than in the upper lip. So we're going to go right there. Just 1 unit, right in the midline. It's the second unit. One more time. I know I have to keep going back and forth, and you know I'm left-handed, so everything's a little bit backwards. And there's our third. Okay, so that's it. So it's 1, 2, 3, 4 in the upper, midline, halfway, halfway. And that's our lip flip. Now we're going to do our nose treatment, and this is going to give it some volume. So what we're going to use is a PDO thread. It's coiled. It's made especially for the nose. And my arthritic hands, I got to open the... Okay. Okay. Are we on? Hmm? Are we on? Okay. So what we're going to do, feel that? Okay. We're going to make a pilot hole right here. Just going to open that. And then we're going to get our PDO thread, which is coiled, made specifically for the nose. And we're going to take our pilot hole out. And we're going to insert. So this is made from polydiaxone thread. It's looped on the needle. It's blunt, so it will not cut anything. Turn it and advance it. And turn it a couple times and pull it out, and there we go. Okay, so what happens there is we'll get a little bit of a lift immediately. It's a little bit swollen because of the anesthetic, and we'll get a nice collagen reaction to it. And if Melanie's around in a couple of weeks, we'll get a much better idea of what we've got now. So Okay, that's the basic Botox, glabella, forehead, crow's eyes, lip flip, and PDO thread nose lift.